Healthcare for All Texans. I've also been a nurse for 35 years. Speak into the mic. So I've seen the effects of our non-healthcare system, our healthcare system that's a non-system on all the people. We don't really have a healthcare system. We have a system for generating profits for a few, not a system for providing for the health of all. That's why 20,000 people a year in the United States die for lack of health care. There's a group of us here from Houston. We've come down here to stand with you today for universal health care and HR 676, which is the only real way to have universal coverage that contains costs and that gives us a real choice of providers, not choice between which middlemen we're going to use to waste our resources, or as a friend of mine calls them, VSPs. That's value subtracting parasites. But I don't want you to think we came to Austin because there's nothing going on in Houston. Now, we have a very active chapter in Houston of Healthcare for All Texas. We're working with other community and union groups in Houston, and every week our speakers are going out to make presentations to community groups, professional organizations, churches. We're planning a faith-based conference in a short while here on single-payer health care, which will include people from a lot of different faith backgrounds. We're, of course, collecting signatures on postcards for support of HR 676 for all of the congressional representatives in our area. We're developing an online calculator, which hopefully will go up soon on the Healthcare for All Texas website, where people can go in and put their current healthcare costs and see what they would be under HR 676. So we can show people what the change would be for them economically. We've been meeting with congressional representatives. We're going to keep doing that. We also have a group called the Win-Win Campaign. The Win-Win Campaign, in case you're not familiar with it, is a national campaign organized by Healthcare Now. And the idea is to show local governments how much money they can save and their employees can save under HR 676. And this has been going on around the country. I mean, Austin has endorsed HR 676, as it was mentioned before. Other major cities, including Detroit, Chicago, Philadelphia, have endorsed HR 676, and we currently have plans, we've gathered data, and we're going to be going before the Houston City Council soon in hopes of making Houston the next city to endorse HR 676. Okay, where was I? So we've been busy, and we will stay busy until healthcare is a human right, not a privilege.
Yeah!